Welcome to episode 101. Today we're going to be talking about Chinese herb Bai Zhi, Angelica dahuricae Radix, or Angelica Root. As always, I am your presenter, Dr. Greg Sperber, and why don't we get into it? Today we'll be exploring another interesting Chinese herb, Bai Zhi, Angelica dahuricae Radix, or Angelica Root. This herb is in the Chinese medical subcategory of warm acrid herbs that release the exterior under the category of release the exterior herbs. It's helpful for certain types of colds and helps unblock the nose and clear dampness. And as usual, we will be exploring something a little different. Today, we'll be looking at maltodextrin, a food additive and carbohydrate supplement. Please stay tuned for another interesting episode. Before we get into that, I wanted to let you know we are starting an amazing special for our courses. If you use them for continuing education, professional development, or just for your own edification, we're offering 50 hours of courses for an unbelievable price. Normally this would cost $750. However, with the special code 50 CEUs or 50 CEUS, this is going to be only $325 or only $650 per hour. That's less than half off. Plus, you can get a free signed copy of one of my books, just pay for shipping and handling. There's a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. Just go to the webpage, www.integrativemedicineCouncil.org/CEUS1, CEUS1, for this amazing deal. That's www.integrativemedicineCouncil.org/CEUS1. Thank you. So last weekend, I updated the third class in my integrative nutrition series, Carbohydrates in Chinese Medicine. I added a monograph on maltodextrin, a food additive and carbohydrate supplement. Maltodextrin is an additive to many foods, especially sweet and baked goods, and is used as a carbohydrate supplement. It is made by ultra-processing various sources of carbohydrates until a white powder is produced. So I emphasize this ultra-processing because I'm getting to the point, and I think research is getting to the point, that when we ultra process our food, when we overly process our food, it makes it less healthy. And so by saying ultra processing here, I'm kind of indicating that this is not a healthy source, a healthy way to take carbohydrates. And we'll get to that as we get into this, but it is ultra processing. It's like taking a normal carbohydrate and just processing until it comes out as a white powder. So I can't think of anything that would be more ultra processing than that. They are low sweet saccharide or sugar polymers consisting of D-glucose units. So glucose is sugar. Main sugar we use in the body, not the only one, but the main one. Units linked primarily linearly with alpha-1,4 bonds. Now, our body can very easily break down alpha-1,4 bonds. We have lots of enzymes that do that, but can also have branch structure through alpha-1,6 bonds. We do not, the only enzymes that break down carbohydrates are in our body are alpha-1,4 work on alpha-1,4 bonds. They do not work on alpha-1,6 bonds. So if they have this branch structure, it usually means that a portion of it is still going to be there when it hits the large intestine. And at that point, it may have some different effects as well with the bacteria that's there in our microbiome. So we'll talk about that a little bit as we go along as well. There is another form of maltodextrin called resistant maltodextrin. This is a fermentable functional fiber which may help total fiber intake as well as potentially positively change the gut biome. So that's an interesting one as well. We'll talk about that too. So uses of maltodextrin. Maltodextrin is one of the most common food additives in the US. It is generally regarded as safe for grass. This is an official designation, which basically means the FDA doesn't regulate it and that they don't see a need to regulate it. FDA meaning Food and Drug Administration for those outside of the US. So it's generally regarded as safe and helps prevent moisture from building up in foods, improve the texture of baked goods and sweeteners, and to reduce sweetness, though it does have a higher glycemic index than sucrose or table sugar. So even though it reduces the taste of sweetness, it actually has a high glycemic index. Now remember what the high glycemic index is. What that is an indicator of what drives glucose into the blood. So a higher glycemic index food is going to put glucose in the blood faster than a lower glycemic index food. And sucrose or table sugar is considered one of the highest glycemic index foods. So if this raises it higher than sucrose, then that is quite a high glycemic index. As a supplement, it is used to increase carbohydrate intake to improve performance and delay muscle fatigue in athletes or athletic endeavors. As already mentioned, resistant maltodextrin may be useful as a form of fiber and probiotic. So that's where, we said earlier, it can potentially positively change the gut biome. That puts it in the category of a probiotic. The science, or actually probably more accurately a prebiotic rather than a probiotic. The science on using maltodextrin as a performance enhancer for athletes appear mixed. A systematic review concludes overall, our findings indicate conventional high carbohydrate intake recommendations of 4 to 10 grams per kilogram per day may be excessive for the performance of strength trainees such as bodybuilders, powerlifters, and Olympic weightlifters. Based on the inconclusive evidence and potential for benefits but not harm, strength trainees are advised to consume at least 15-gram carbohydrates and 0.3 grams per kilogram protein within 3 hours of their training sessions. That's a lot less than 4 to 10 grams per kilogram per day. There's only 15 grams total. So that's a lot different. If the workout contains 11 or more sets per muscle group, or there is another high intensity workout planned that day for the same musculature, higher carbohydrate intakes up to 1.2 grams per kilogram per hour may be warranted to maximize glycogen resynthesis in between workouts. So it's 1.2 grams per kilogram per hour versus 4 to 10 grams per kilogram per gram, 4 to 10 grams per kilogram per day. So that's high carbohydrate intake, but it's also a lot shorter than the whole day sort of thing. So I don't know how that all works out, but they do say possibly you could do higher. A small study, N equals 10. So that's a really small study and not a study that we can apply population statistics to. We need at least an N equals is number of subjects. We want at least 30 to 40 subjects before we can start doing population statistics. But a small study found pre-exercise carbohydrate intake does not alter brief resistance exercise performance to fatigue when one is already consuming adequate dietary carbohydrate. And they also found carbohydrate supplementation did not accelerate glycogen recovery within 1 hour recovery. So basically, that's saying that carbohydrates play very little role in this as long as you have an adequate carbohydrate intake. And that's going to happen in almost everyone unless they're in a very strict no carbohydrate diet. So they're basically saying you don't need to. But this is a small study, but it was a human study. So that's, the carbohydrate, using this as a carbohydrate supplement. Another review of resistant maltodextrin, so this is more of the fiber end of things, found resistant maltodextrin is fermentable in the colon and thus produces short-chain fatty acids. Now, short-chain fatty acids are what we're looking for. That is what, when we say there's a healthy biome, it means that they are making short-chain fatty acids. So that's a positive finding that it produces short-chain fatty acids in the colon. Resistant maltodextrin helps to maintain blood and lipid profiles as well as promote satiety, and so satisfaction and fullness, and reducing food intake. This is supported by a small randomly controlled trial with an N equals 51. So this is over that 30 to 40. So we can apply population statistics here, which found resistant maltodextrin increased fecal bifidobacteria counts and stool wet weight, suggesting health benefits from increasing total fiber intake. So here's the bottom line with that is it does appear to be a fiber. It does appear to have positive effects like a fiber does, and it also appears to be prebiotic. All those are good things. So no issues with any of that whatsoever. But that's the resistant maltodextrin. That's not the super ultra processed white powder carbohydrate supplement. That's not resistant maltodextrin. It's just maltodextrin. So that's different. So let's look at dosage for athletes. One study found using up to 1.2 grams per kilogram per hour was appropriate. Another study of resistant maltodextrin used 15 and 25 grams daily, showing benefits in a small study, n equals 10. Side effects and red flags. Maltodextrin has a higher glycemic index than sucrose and can spike blood sugar levels in diabetics. So this is not something for diabetics. It may negatively impact the gut microbiome and increase the risk of inflammatory bowel disease, gastroenteritis, and other inflammatory conditions. Now, this is regular maltodextrin. This is not that resistant maltodextrin, which may positively impact the gut microbiome. So regular maltodextrin, it has these potentially negative impacts. Allergic reactions are possible. And since maltodextrin has calories with no nutritional value, it can facilitate weight gain. So that is something to be concerned about. Resistant maltodextrin may cause unpleasant gastrointestinal symptoms such as cramping, flatulence, and bloating. These symptoms are often byproducts of bacterial fermentation of the undigested fiber. So these are typical with fiber and prebiotic sort of supplements as well. So those are kind of typical side effects for that. So resistant maltodextrin didn't seem to have any other side effects other than what we would expect from a good fiber. Interactions. As would be expected with such a common food additive, there were no obvious interaction risks with maltodextrin upon a literature search. So I always, when I do a literature search, I always look for, I do 3 searches. I do blank, so in this case, maltodextrin drug-herb interactions. And then I look for cytochrome P450 interactions, so maltodextrin cytochrome P450 interactions, and then maltodextrin P-glycoprotein interactions. And I usually do that in Google Scholar, so I'm looking up scholarly works for that. So those are how I do that in general, and nothing came up on that literature search. And then with the results, because there's always hundreds of results, I always go down to at least 50 results in the literature search. Didn't find anything on maltodextrin. So what is maltodextrin in Chinese medicine? In Chinese medicine, maltodextrin is one of several possible excipients used in the manufacture of herbal granules. Given this use, it appears maltodextrin is probably considered relatively inert in Chinese medicine, at least in small quantities. However, in larger quantities, which would be supplement quantities, it is probably considered an energy source. This probably places it in the realm of a spleen tonic. Even though it is not as sweet as sucrose, it would still be almost a pure form of the sweet flavor in Chinese medicine, meaning it is possibly spleen supplementing in small quantities and spleen toxic in large quantities. So that's the thing is, we say that sweets are good in very small quantities, they're tonifying, but in large quantities, they blow out the spleen. It's too much for it. So I think maltodextrin would fall into that category of things according to Chinese medicine. And with that introduction to maltodextrin, let's talk about our herb today, which is Bai Zhi, Angelica Root, and it's from the family Apiaceae. Standard species here is Angelica dahuricae, fish X hoffum. So fish, F-I-S-C-H, X hoffum, H-O-F-F-M, refers to the previous botanist who first classified this. And then, and those are in parentheses. That's why we know it's the previous ones. And the current ones are Benth, B-E-N-T-H, and Hook F, which refers to the botanist who put it in its current classification. So the whole standard species is Angelica dahuricae, in parentheses, fish X hoffum, out of parentheses, Benth and Hook F. So F, I think, is I'm not sure exactly what that F is. It's lowercase f, which is interesting. And that is our standard Bai Zhi species. And then we also have another standard species, Angelica dahuricae, all the same, fish X, hoffum, Benth, and Hook F, variant Formosana with Bors, B-O-R-S-S in parentheses as a botanist, and Shan and Yuan as the botanist who classified that. So a variant of it as well. And this is Hang Bai Zhi. So H-A-N-G in Chinese, Hang Bai Zhi. So that's a lot. So there's 2 standard species, but huge names for those with all the botanists and everything, all huge standard names for them all. The medicinal part is the root, and the English is Angelica Root. That's Bai Zhi. Actually, Bai means white, I think. So I didn't get a pure English translation of this for some reason. I couldn't find it. So it just is translated as Angelica Root. Other names include Chuan Bai Zhi, Hang Bai Zhi, which we mentioned earlier, Hui Bai Zhi, Qi Bai Zhi, Xiang Bai Zhi, Xiang Da Huo, Yu Bai Zhi, Zhou Ma Qin, and Feng Xiang, which means fragrance. And then in Japanese, it's Byakushi, and in Korean, Baekji, by B-A-E-K-J-I. Again, I can barely pronounce Chinese, and I can't pronounce Japanese and Korean at all. So this is the Apiaceae from the Apiaceae family. The Apiaceae family is the parsley or carrot family and includes edible plants and spices such as the carrot and parsnip, anise, celery, chervil, coriander, caraway, cumin, dill, and fennel. And poisonous hemlock is also a member of this family. There are about 34 genera. Elpel says there are about 300 genera and 3,700 species. That's quite a discrepancy on the genera. They have hollow stems, taproots, and flat-topped flower clusters known as umbels. A taproot, by the way, is the main root of a primary root system growing vertically downward. So I think of taproot as like a carrot would be a taproot, sort of thing. So flat-top flower clusters known as umbels. A previous name for this family was the Umbelliferae, using that word umbel, referring to these umbels, which is where the stems of the flower cluster radiate from a single point at the end of the stalk, kind of like an umbrella. So that's where we get umbels from, umbrella. So going back to Bai Zhi or Angelica Root, remember we have 3 main texts that we use when we are looking at this. The first one is Bensky and his team, Bensky, Clavey, Stoger, and they say the dosage is 3 to 9 grams. We have Chen and Chen, and they say it's 3 to 10 grams with a maximum of 30 grams. And Brandon Wiseman also say the dose is 3 to 10 grams. So those are pretty standard doses and essentially the same across all 3 books, give or take. Category, Bensky et al. Puts this herb in the warm, acrid herbs that release the exterior subcategory under herbs that release the exterior category. Chen Shen say it is in the wind cold releasing herbs subcategory under the exterior releasing herbs category. And Brandon Wiseman say it is a warm, acrid exterior resolving medicinal under the exterior resolving medicinals category. So in other words, they have slight differences in the words, but they all are saying the same thing. Bensky says it is acrid and warm and enters the lung, stomach, and spleen, while Brandon Wiseman does not include the spleen meridian. Bensky and Chen both say it is enters the lung, stomach, and spleen, while Brandon Wiseman does not include the spleen. History, both Bensky et al. And Chen say the original source for this herb is the Shendong Ben Cao Jing, or Divine Husbandman's Classic of the Materia Medica in the 2nd century CE. We see a lot of herbs come out of this particular book. It is the oldest existing book on single herbs. So what that means is there may have been, and probably were, books on herbs before this, but this is the only one surviving. And it basically is, if it's included in the Shendong Ben Cao Jing, it's probably amongst the oldest herbs known to Chinese medicine. So this is an old herb, Chinese herb, basically. So let's talk about herbs that release the exterior, the category. We have now discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs, and we'll repeat that information here just for completeness. So according to Bensky and his team, exterior releasing herbs are those that release disorders lodged in the very superficial levels of the body. When external pathogenic factors, including wind heat, wind cold, wind dampness, and summer heat, invade the body, they first attack its superficial exterior aspects. Symptoms associated with the exterior then appear: chills, fever, headache, stiff neck, and general muscle aches. Sometimes sweating will appear, which resolves the condition, in which case no treatment is necessary. At other times, however, there will be an absence of sweating, or even though there is sweating, it is not accompanied by any change in the condition. At this juncture, herbs that release the exterior are used. Most exterior releasing herbs are diaphoretics. That is, they release or expel the external pathogenic influences through sweating. There's a saying in Chinese medicine: when the disease is in the skin, sweating will bring it out. When a disease progresses slightly further into the body, it is said to lodge in the muscle layer. The clinical presentation then includes fever, general body aches, and profuse sweating. At this stage, especially when the patient has sweated without any beneficial change in their condition, it is appropriate to use a subset of herbs that release the muscle layer. The most prominent member of this group is Cinnamomum ramulus, or Bai Zhi. That's cinnamon twig. Some of the herbs that release the exterior have additional functions: stopping coughs and wheezing, controlling pain or spasms, and preventing rashes such as measles. So that's herbs that release the exterior. Let's do the subcategory: warm, acrid herbs that release the exterior. So not just herbs that release the exterior, but now they're warm and spicy, warm and acrid. So Bensky et al. Continues to discuss the subcategory of warm, acrid herbs that release the exterior. Herbs that release the exterior can be further divided by character and function into warm acrid and cool acrid classes. The warm acrid herbs dispel wind cold and are used for exterior disorders when the fever is mild, the chill severe, and there are other signs and symptoms of wind cold, including headache, body and neck pains, and absence of thirst. So that is an overview of our categories of herbs here. Let's get into what makes good quality Bai Zhi. So Bensky and his team say the best quality consists of big single roots, not more than 36 roots per kilogram. The roots have if it's more, then there would be smaller roots, in other words, so 36 roots per kilogram. The roots have a grayish brown or yellowish brown surface, a white starchy cross section, an intense aromatic fragrance, and no holes, black spots, or oil channels in the center. Chinese medicinal identification and illustrated approach says Bai Zhi has a semi-conical shape. The upper portion is nearly square, and there are 4 clear edges. Externally grayish brown or yellowish brown. It has a hard texture, aromatic odor, and an acrid, slightly bitter taste. Superior medicinal material is thick and strong, hard, white, powdery, but potently aromatic. It has pimple spots, which refers to raised horizontal lenticels on the cortex arranged in 4 longitudinal directions, and there are indented stem scars on the apex. Now that's the normal Bai Zhi that we were talking about. The Hung Bai Zhi is slightly different, but there you go. That's the standard Bai Zhi species that we're talking about here. So what does it do according to Chinese medicine? According to Bensky and his team, Bai Zhi expels wind, eliminates dampness, unblocks the nasal passages, and alleviates pain for patterns of externally contracted wind cold, especially those with headache. Also for supraorbital pain, nasal congestion, and toothache. So while this isn't like our main herb for nasal congestion, it is almost always used in nasal congestion formulas as well. It's used in combination with our main herb, which we've talked about in the past, Sungardza. But this is definitely up there as one of our main nasal congestion herbs. While primarily a warming herb, it can be used for any problem due to wind invading the young brightness channels of the head. So that's all under the expels wind, eliminates dampness, and unblocks the nasal passages and alleviates pain. Action, Chinese medical action. Another Chinese medical action, reduces swelling and expels pus for early stages of superficial sores and carbuncles. If the sore, ulcer, or carbuncle has not yet suppurated, this herb will help reduce the swelling. If pus has already formed or the sore has ulcerated, the herb can be used to help discharge the pus. We always talk about fun things. Another function is expels dampness and alleviates discharge, usually for vaginal discharge due to cold dampness in the lower burner, but with the appropriate herbs can also be used to treat vaginal discharge from damp heat. Other uses with Glyceraceae radix or consau, which is licorice, for pain associated with ulcers. So you can use it for ulcers. So those are the functions according to Bensky and his team. Chen has its own set of functions, and they say it releases the exterior, dispels wind and opens orifices, dispels cold and relieves pain, reduces swelling, expels pus and eliminates toxins, and dispels dampness and treats leukorrhea and diarrhea. So leukorrhea is white discharge, vaginal discharge. So very similar to what Bensky said. Brown and Wiseman say it resolves the exterior and disperses wind, dispels wind and relieves pain, disperses swelling and expels pus, dries dampness and checks vaginal discharge, and as an additional action, it has itch relieving action that makes it suitable for topical application to itchy skin. So that's a bit of a new one for us there. The rest all seems very much in line with Bensky and Chen. Chinese medicinal identification and illustrated approach says it disperses wind, eliminates dampness, frees the orifices, relieves pain, disperses swelling, and expels pus. We have a lot. These all seem to be very much in common with each other, having the same sort of thing. It's the topical application is a little bit different, but topical applications are definitely included with all of these as well, as we're going to see in just a moment. And then finally, the Shendong Bensao Jing, or Divine Husband's Classic of the Materia Medica, says it mainly treats leaking red and white vaginal discharge, blood block, and swollen genitals in females, and cold and heat, head wind, and wind invading the eyes causing tearing. Promotes the growth of the muscles in skin and moistens and makes the skin shiny. And it can be used to make a face cream. So I always like including the Shendong Bensao Jing as in our Chinese medical actions, because these were the first Chinese medical actions that we have still. So that's important. But I kind of look at these as more of a historical sort of point rather than modern usage. So a lot of what we see here is just not something we'd be using modern days, and it actually says it helps the eyes rather than the nose, which is definitely, I can see it helping the eyes, but we usually think of it as helping the nose. So I kind of feel like this is more historically interesting rather than useful modern day uses of this herb. So let's talk about preparations. Bensky and his team described two preparations. The first one is dry fried Angelica root, or chow Bai Zhi. Baking or frying at low heat until slightly brown will reduce the herb's ability to spread and vent, after which drying becomes its dominant effect. This method of preparation is used for cold, damp vaginal discharge. And then our second preparation is charred Angelica root, or Bai Zhi Tan. The herb is baked or fried over a high flame until it is scorched. In the past, this form was used to stop bleeding, particularly for menstrual spotting, but this use is less common in recent times. So this is not one of the herbs I would think about charring and using that. It wouldn't be one of the first ones anyways. And when we char something, we say its job is to stop bleeding. That's what happens when we char an herb. So, but there are other herbs that are probably more useful at stopping bleeding once we char it than Bai Zhi is. So this would not be on the top of my list as to which herbs should be charred. You know, if I have someone I'm trying to stop bleeding with, then I'm going to use other herbs. Okay. Chen also briefly discusses a single preparation that they have, saying it can be taken internally or applied topically in powdered form. When treating dermatological disorders, the dosage should be decreased as the sores heal. So it can be used dermatologically as well. Western uses of this herb. So always, you know, we go from, when we talk about Western herbs, we try to talk about what they do according to Chinese medicine, and we like to go vice versa as well. So Google search yielded no Western or other herbal traditional uses for this herb. It appears to be exclusively a Chinese traditional herb. Now, don't get me wrong, I saw it a lot. I mean, when I do research, there was a lot of it on the research, but they all talked about the Chinese medical functions of it and often said this is a Chinese medical herb. So there wasn't any herbs, any use of this that was not Chinese in origin, in other words. And this is supported, the big book I have on Western herbs is the PDR for Herbal Medicines, and it does not mention this herb at all. So there you go. And as usual, Bensky and his team has an excellent commentary on this herb. And so let's talk about that. Entering the lung, stomach, and spleen channels, Bai Zhi is acrid, dispersing, aromatic, unblocking, warm, and drying. All these qualities make it very effective in eliminating dampness. It is best at expelling wind, releasing the exterior, drying dampness, opening the orifices, especially the nose, and relieving pain. It is particularly effective in treating symptoms on the head and face, such as wind cold-induced frontal headaches or pain in the bones under the eyebrows, swelling and pain in the teeth and gums, and sinus obstruction. However, due to its ability to raise yang as well as eliminate dampness, it is also commonly used in the treatment of vaginal discharge, especially when it is prepared by dry frying. Seeking accuracy in the Materia Medica, the Bensao Qiu Jian, written in 1773, summarizes many of the characteristics of this herb. Bai Zhi, warm and full of power, opens the orifices and travels through the exterior. It is a major herb for expelling wind and clearing dampness from the leg yang brightness channel. As such, it treats all head and facial symptoms along this channel, which arises from the nose and links to the eyes, thus involving the entire face. But because its nature is rising and dispersing, those with heat in the blood and yin deficiency fire must avoid it. It can be slightly fried. So that is the commentary. A little bit short by Bensky standards, but as usual, very useful. But we also have a commentary, some information from Chen and Chen as well. So they have an interesting commentary on this herb as well as others in regard to headaches. Optimal treatment of headache requires use of channel guiding herbs to deliver the therapeutic effect of the herbs to the affected area. Chang Huo, Rhizoma et Radix notopterygiae, Chuan Shang, Rhizoma ligustici, Chuan Shang, Bai Zhi, which is our herb, Radix Angelica dahuricae, Chai Hu, Radix pupillari, and Gao Ben, Rhizoma ligustici, all treat headaches. According to Dr. Li Shou Shan, the differences between these herbs are as follows. Chang Huo is more specific to occipital headaches. Chuan Shang is more effective for headaches related to menstruation. Bai Zhi focuses on frontal headaches, which makes sense because that's where the channels involved happen or are there. Chai Hu treats temporal headaches. Gao Ben is best for vertex headaches. They additionally comment, Bai Zhi is traditionally used as a component of cosmetic foundations. It whitens and softens the skin and invigorates blood circulation. Comparisons. Bensky et al. Compares this herb to Notopterygiae rhizoma su Radix Chianghuo, which we just mentioned, Ligustaceae rhizoma Gaoben, which we just mentioned, and Asari herba Shishin. By the way, I think we've done superb herbs on all of these. If not Gaoben, it's coming up. But I think we just did it. All of these herbs are very acrid and warm and can be used to dispel wind cold, wind dampness, cold dampness, and to relieve pain. Angelica dahuricae Radix Bai Zhi is best for pain in the forehead, eyebrows, teeth, and gums, but can also reduce swelling, expel pus, stop itching, and vaginal discharge. Notopterygiae rhizoma su Radix Chianghuo has a strong aroma that rises to expel roving wind in the muscles and exterior. It is best for neck and shoulder pain. It also frees up joints by venting pathogens from between the sinews and bones. Notopterygiae rhizoma su Radix Chianghuo and Ligustaceae rhizoma Gaoben both enter the governing vessel, but the tendency of the former to move upward is stronger. Ligustaceae rhizoma Gaoben is better able to address disorders in the lower body. Ligustaceae rhizoma Gaoben also has a powerful ascending nature, reaching the top of the head and treating headache involving the teeth. It is also able to relieve abdominal pain and diarrhea due to cold dampness or gynecological swelling and masses. Asari herba or Shishin is very effective at dispersing pathogenic wind cold dampness and is especially good for opening the orifices and relieving pain. Its warmth can also transform cold, thin mucus. Combinations. Bensky and his team combines this herb with 3 others. With Puraria radix or Gugun, this combination is designed to reach a very specific location. While both herbs are acrid and enter the yang brightness, Bai Zhi is warm, while Puraria radix Gugun is cool. Together, they excel at relieving chills and fever from the level of the exterior muscles and interstices. This level of the exterior pertains to earth and is known as the exterior of yang brightness. When wind cold invades and penetrates, usually rapidly, to this depth, it can become stuck, produce heat, and lead to chills, fever, lack of sweat, stiff neck, headache, restless anxiety in the chest, and a floating, tight pulse. At this level, however, it is inappropriate to use skin-level herbs like Ephedra herba ma huang or muscle-level herbs like Cinnamomum ramulus guizhi, nor do wind heat clearing herbs such as Morifolium sanguae or Chrysanthemum floss juhua achieve the desired results. This is because the root pathogen is wind cold, despite the heat resulting from its confinement in the exterior membranes and interstices. Only the use of 2 dispersing yang brightness channel herbs, one warm, one cool, can produce the effect of dispersing at the proper level to free the pent-up pathogen, ushering it out through the exterior. While Puraria radix Gugun disperses and cools the heat from constraint and frees the pathogen from the exterior membranes and interstices, the warming Bai Zhi increases the local yang qi activity to expel the obstructing cold pathogen out through the skin. So that's our one combination. Our next one is with Chuangshan rhizoma or Chuangshan. Chuangshan rhizoma, Chuangshan is acrid and warm and enters the lesser yang channel. Its nature is expressly dispersing and ascending, which enables it to move around the eyes and head. It is a superior herb for eliminating wind and relieving pain. Extension of the Materia Medica that Ben Sayan Yi, written in 1116, notes Chuangshan rhizoma, Chuangshan, is a very commonly used herb at present, but when it fails to completely clear wind from the face and head, other herbs should be added to assist it. Thus, when Bai Zhi is added for this purpose, its wind-expelling and pain-relieving actions supplement those of Chuangshan rhizoma, Chuangshan, and it leads to the actions of Chuangshan rhizoma into the yang brightness channel. For these reasons, this pair is most often prescribed for headaches involving both the lesser yang and yang brightness areas of the head, especially those chronic headaches which are aggravated by exposure to wind and cold and involve a sharp stabbing pain. Although resulting from wind, these chronic headaches differ from recently contracted exterior wind headaches, as the former usually involve repeated encroachment by wind on the clear orifices of the head. Such long-term disorders enter the collaterals and obstruct the flow of qi and blood, for which the usual wind-cold expelling herbs are inadequate. Xuanshang rhizoma xuanshang is required because of its ability to both expel wind and move the blood. In more severe cases, the addition of other herbs to move the blood is warranted. We have one more combination that we're going to talk about, and that is with Bombyx batricicatus Bai Zhi. Bombyx batricicatus Bai Zhi is salty, acrid, and neutral. And like Bai Zhi, it has a strong ability to expel wind and relieve pain. The two herbs combine their strength in this area and are commonly used for frontal headaches associated with pathogenic wind in the yang brightness channel. This combination is then adjusted according to the nature of the wind pathogen. For wind heat, use relatively more Bombyx batricicatus Bai Zhi and vice versa for wind cold. In addition, because both herbs can dry dampness, while Bai Zhi also raises the yang and Bombyx batricicatus, I'm going to be able to pronounce that very well after this, Bai Zhi also transforms phlegm, they are useful together in the treatment of continuous vaginal discharge from the downward pouring of turbid dampness. For this purpose, they generally serve as ancillary herbs within a prescription. So that's the combination of herbs that we have so far. Let's continue with the contents of Bai Zhi. So according to Bensky et al., the contents of this herb include volatile oils and furanocoumarins. Chen highlight the coumarins. Those seem to be important constituents of Bai Zhi. We're going to get into those now. A review article says, to date, more than 309 chemical components were isolated and identified from A. dahuricae. Phytochemical studies have revealed the presence of coumarins, volatile oils, alkaloids, phenols, sterols, benzofurans, polyacetylines, polysaccharides, and others. Currently, studies on the chemical components of A. dahuricae mostly focus on the root of A. dahuricae. Coumarins and volatile oils are the predominant constituents of A. dahuricae root, Angelica dahuricae root. Zhao et al. Continue to say coumarins are the most abundant main bioactive constituents present in A. dahuricae. They have a broad spectrum of pharmacological activities such as antiviral, anti-tumor, anti-osteoporosis, and effects on the cardiovascular system. To date, a total of 153 coumarins have been isolated from the root and stem of A. dahuricae, include 18 simple coumarins, 93 furanocoumarins. You can see why Bensky emphasized the furanocoumarins, 41 coumarin glycosides, which means that a coumarin attached to a sugar, glucose, and 3 other coumarins and 3 coumarin derivatives. Among them, the furanocoumarins are the most abundant coumarins. Volatile oils are other major physiologically active compounds in A. dahuricae. The components of volatile oil can be roughly divided into 4 categories, including terpenoids, aromatic compounds, aliphatic compounds, and other compounds. Among them, terpenoids are the most common type. Numerous studies declared that the cluster of the compounds possess extensive bioactivities and act as antibacterials, antivirals, and insecticides in plants. So far, approximately 121 volatile components have been identified from the root of A. dahuricae. So that was the contents. Let's talk about science. What does the science say about this herb? So according to Chen and Chen, the pharmacological effects of Bai Zhi include being antibiotic, anti-inflammatory, analgesic, antispasmodic, Negatively chronotopic, which means it lowers the rate of the heart, lowers heart rate. Negatively chronotopic. Antihypertensive, which means it helps hypertension. Increases the depth of respiration, so how deep you breathe in. Neurostimulant, and mildly hemostatic, which means that it stops bleeding, mildly stops bleeding. These effects were all demonstrated in small animal studies or bench research. In other words, these are not clinical studies. And when we're talking about clinical uses of items, we want clinical studies. Those are the only ones that count. Just because it does something in a rat doesn't mean it does the same thing in a human. So they also discuss a few clinical studies with Bai Zhi. One study of 73 patients with occipital headaches and another with 62 patients with headaches. So those are smallish studies. The occipital headaches, remember we said this is probably better for frontal headaches than occipital headaches, but a study showed good effects on occipital headaches. And the other one wasn't as clear, it just said headaches. Topical Bai Zhi was used to treat vitiligo in 321 patients with 61.5% showing significant improvement. So a couple things there. This is an older Chinese study. How they define significant improvement is questionable, and generally they're not well regarded in modern research circles. But this is a relatively larger study, 321 patients, and 61.5% is a significant amount of improvement. And there's probably no harm in topical Bai Zhi, so it certainly is an option for vitiligo. Vitiligo, remember, is that disease of hypopigmentation, so they have patches of white skin and admits in the middle of the regular skin. So, and finally, another study orally administered Bai Zhi was used to treat 159 patients, and I did not put down what kind of patients, so I will add that in. But I think it was eczema patients. That's what it was. It was eczema patients. Orally administered Bai Zhi was used to treat 159 eczema patients, which was interesting to me because it was oral rather than topical and had good results. So Zhao and his team, or their team, says Bai Zhi may be anti-inflammatory, anti-tumor, antioxidant, analgesic, antiviral, and antimicrobial, anti-hyperlipidemic, so it lowers cholesterol and lipids, blood lipids, anti-diabetic, immunoregulatory, as well as positive effects on the cardiovascular, liver, and neurological systems. And these all appear to be based on in vitro studies, with a few in vivo in rats and mice. So again, not strong. In vitro basically means bench research. That's in test tubes. In vitro means in glass. In vivo means in life, but usually we say in vivo is animals. So in this case, rats and mice, not clinical, not in humans. So again, all of these effects are interesting, but they haven't been shown in humans at this point. Another review that came out in 2023, a year after the Zhao and their team, has very similar effects and sources adding wound healing to its effects. The bottom line is, while there is plenty of low-level evidence, there does not appear to be strong clinical evidence for the use of Bai Zhi, which, by the way, is going to be for most of our Chinese herbs, and yet I still use them. I still think they're useful. Okay, so that's the science. Let's talk about drug-herb interactions. While there appears to be quite a bit of literature showing cytochrome P450 interactions with Bai Zhi, however, these involve studies of specific components and were either bench in vivo research or in rats and mice. In other words, not humans, and therefore it may or may not have these same effects in humans. But one study, very interesting, of 24 healthy males, so a little bit off, a little bit small, just men, I don't know why it was just men, showed no significant changes in cytochrome P450, 2C9, 2C19, 2D6, 2E1, and 3A4. Those are all the major ones. So clinical studies do not show cytochrome P450 interaction. So I do not think these actually interact with cytochrome P450 in humans, though there is, based on the rat research and the in vivo research, at least some potential risk for cytochrome P450 interactions. I'm not worried about it. The literature does not show any P-glycoprotein interactions or other general interactions. And the American Herbal Products Association's Botanical Safety Handbook puts this herb in interaction class A, herbs for which no clinically relevant interactions are expected. So in other words, I think this is a fairly safe herb for drug-herb interactions. At this point, we may do more research and that might change. But at this point, the research shows that it's probably not an issue for drug-herb interactions. So let's talk about some concerns about this herb. So Bensky and his team note several concerns with Bai Zhi. Under the heading of cautions and contraindications, they say, contraindicated for problems due to yin deficiency or heat in the blood. Once a sore has ulcerated, the use of this herb should be tapered off. Under the heading of traditional contraindications, they say, its drying nature can injure the blood, its dispersing nature can injure the qi, and it is forbidden in cases of fire from deficiency, and also in any case of vomiting due to fire. It cannot be used for red and white vaginal discharge resulting from accumulated fire from deficiency or heat in the blood. Remember, this is a warming herb that we don't want to add it to fire or warmth. It can be used to bring out and express boils, but once the sores have come to a head and burst, the dosage should be gradually reduced. And this comes from Harm and Benefit in the Materia Medica, or the Ben Sao Hai Li by Ong Huan, written in 1893. So while that's, you know, over 120 years old, 130 years old, it is still considered relatively modern in Chinese medicine. And then under the heading of toxicity, Bensky and his team say a high dosage, 30 to 60 grams of the herb, can cause toxic reactions. Symptoms include nausea, vomiting, dizziness, palpitations, shortness of breath, profuse sweating, high blood pressure, convulsions, restlessness, dyspnea or trouble breathing, precordial pain, so that's pain in front of the heart, and even respiratory arrest, so stop breathing. Allergic reactions affecting the skin have been reported. In addition, contact of the fresh herb with the skin can cause contact dermatitis. This herb contains furocoumarins, which are known for their photosensitizing effect. And they say here, xanthotoxin goes to bergaptan, which goes to alloisoimperatorine. So I'm assuming that is where the photosensitivity comes from. So this is important. So this photosensitivity, these substances can cause dermatitis salaris, erythema, swelling, pigmentation, thickening of the epidermis. So while there are no known reports of ingestion of Bai Zhi leading to these problems, to be safe, those taking this herb should limit their exposure to the sun. So what that means is they can be photosensitizing, it can be exposure to the sun, but it could also, we have to take this one step further as acupuncturists. And if someone's on a fairly high dose of Bai Zhi, we might want to be careful with our infrared lamps. Most of us will, or at least in the United States, use infrared lamps to warm up areas. That is a form potentially of that can affect photosensitizing drugs and herbs. And so I'd be a little bit cautious with that. If it were me, I wouldn't not use it. I would still use my infrared lamp, but I'd probably be a little bit further away than usual. I'd probably be a little bit more cautious than I usually would be with that. Still in concerns, Brown and Wiseman have a warning contraindicated in yin vacuity with blood heat. And Chen say acrid and warm Bai Zhi may damage yin and should be used with caution for patients who have yin deficient fire, liver yang rising, or liver or kidney yin deficiency. This herb is contraindicated for patients with febrile disorders. Overdose of Bai Zhi may cause nausea, vomiting, numbness of the limbs, epilepsy, and convulsions. So a little bit different than what Bensky and his team say can happen from an overdose. And finally, the American Herbal Products Association's Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. So a lot of the cautions that we're talking about with Chen, with Bensky, with Brown and Wiseman is that it's not being used appropriately. They're warning it that this is an inappropriate use of this herb. So as long as we heed those warnings, I think this is a relatively safe herb, and the American Herbal Products Association's Botanical Safety Handbook agrees. Summary. We're at the end. We're wrapping up. Today, we start with our discussion of maltodextrin, what it is used for, and what the science says. not super there. I didn't mention it while we were there. You know, we talked about maltodextrin. I don't think it's a great supplement. I do not think anyone should be taking it as a carbohydrate supplement. I don't think carbohydrate supplements are actually all that useful, even for athletes. So I'm not a big fan of it as a supplement that way. And then we also talked about the resistant maltodextrin as a fiber supplement. And while I'm not opposed to its use as that, I think there are other fiber supplements that are more effective and probably cheaper and easier to get than the resistant maltodextrin. So it wouldn't be a huge choice of mine for fiber and as a prebiotic, but it's nice to have that as an option. So that would be my sort of personal summary of maltodextrin. After that, we looked at another single Chinese herb, Bai Zhi, Angelica dahuricae Radix, or Angelica Root, from the subcategory of warm acrid herbs that release the exterior. It appears to be relatively safe and helpful for certain types of colds and helps unblock the nose and clear dampness, though more clinical evidence is necessary. As usual, we explored all the intricacies of this herb as well as an explanation of its category. What a great exploration of a very useful and important herb. This is, I wouldn't put this in the like top category of herbs, but it is a commonly used herb, especially what I find is with nasal things. You know, it's Sangurza and Bai Zhi are the two herbs we think about. We talk about nasal congestion especially, but sinusitis, things along those lines. So it's a very useful herb and it's commonly used for those situations. So it's a really good herb. In our next episode, we will explore one of the most important Chinese herbal formulas. I consider this one of the top 5 to 10 formulas. Liao Zhenzitang, or 6 Gentlemen Decoction. This is a very common formula used to treat qi vacuity with dampness. We will do our deep dive into this formula and find out if there is any evidence for these effects. And as usual, we will be adding something a little different. It is going to be another fascinating expedition into the deep sea of herbs. Please join us in 2 weeks. Thank you very much for listening today. If you like this podcast, please do us a humongous favor. Subscribe in your favorite podcast app, or that would be awesome. Thank you. And we appreciate you just even thinking about subscribing to us. And don't forget our amazing continuing education deal at www.integrativemedicinecouncil.org/CEUS1, CEUS1. So it's Integrative Medicine Council, COUNCIL.org/CEUS1. We have an amazing deal on 50 CEUs, 50 hours of courses, or we also have, and I didn't talk about, we have an amazing deal on 25 hours. Just an amazing deal at 25 hours. So if you don't need 50, you can go for 25. Still get a great deal. And you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. That's SPERBSHERBS.com. And here's our bibliography. As usual, it's a good bibliography. Thank you very much.